Good afternoon, everyone. The Ways and Means Committee meeting will come to order. The clerk will note the roll. There is a quorum. We actually have the minutes of the last meeting here before us from December 6th. Would someone like to move approval? Representative Carlson moves approval of the minutes of the December 6th meeting. All in favor say aye.
Aye.
Opposed? Motion prevails. The minutes are approved. Members, before we get to the business of the meeting, I'd like to make a couple of other announcements. We have a new member of our committee. Representative Cornish, of course, is no longer a member. Representative Herthaus has been appointed in his stead. Welcome, Representative Herthaus. And we also have a new committee administrator who's making his way up to the front. As people, I think, know, our former committee administrator, Craig Stone, was promoted to take the position that Bobby Patrick had. Harry Kennedy is our new committee administrator, and for those who have been on the committee a long time, Harry was the committee administrator for this committee back in 2011 and 12. So we are picking up someone who is experienced. I'm not sure if he considers this a promotion or not. I don't know. I mean, he was here, he left, now he's back. Who knows?
Good to be back.
For sure, you gotta.
We have some other members who look like they're new members, but they're not. Representative Garofalo, I like the beard.
Nay.
Well, members, today's topic is informational only. I wanted to have this meeting because, first of all, we had a House Republican caucus meeting earlier today, so many of us were already in. And I thought that as long as we were here, there were a couple of topics that merited discussion in an informational hearing where there'd be no action before we actually went into a hearing, in 2 weeks. The first item related to health care is there have been some changes at the federal level over the last couple of months that affect health care funding in this state. Some of it affects general fund money. The CHIP funding, Children's Health Insurance Program, was one of the main reasons we had a projected deficit back in December, at the end of November with the November forecast. That's now been restored. But there have been some other changes that, while they don't affect the general fund, affect the basic health plan, Minnesota Care, and I thought that as we got into session here, it might be useful to briefly review that. And then the second item I'll talk about a little bit more later, but it's the whole concept of some sort of a continuing resolution that might be considered to prevent a government shutdown at some point in the future. The reason I'm bringing it up is there was language in the Supreme Court decision of Dayton versus the legislature that called into question somewhat whether the Ramsey County Court would continue to fund essential services for state government if the legislature didn't appropriate money at some future date. Now, this isn't any sort of concern today. We have passed funding bills last year that fund our state government through June 30th, 2019. We've got quite a bit of money in our budget reserve. I personally expect we'll have a surplus when the February forecasts come out. So there's no reason that anyone should think that we're considering something because we think there's some sort of imminent danger of an issue. But that's exactly a good time to bring it up. And so I thought that in light of the court landscape changing a little bit, it's something that I thought was worth talking about. But I'll have a few more comments on that in a little bit. First, let's talk about health care, and is Mr. Greeman here? Mr. Greeman, welcome to the Committee on Ways and Means. Can you talk to us about the CHIP program and about the changes at the federal level that affect our basic health plan?
Thank you, Mr. Chair. My name is Dave Greeman. I'm the Budget Director at the Department of Human Services. I'm here today, as the Chair mentioned, to talk about CHIP and the basic health plan. I just wanted to orient you real quickly. In your packet, you should have a one-page document that sort of is a summary of the CHIP program and some of the recent developments around the CHIP program. And then also there's a sort of a landscape spreadsheet that shows the finances of the basic health plan, and that's something, I probably won't go through this in detail, but if you're interested, I can certainly walk you through it. And Mr. Chair, I was going to start with the CHIP program, if that's okay with you.
Sure, that's fine.
Okay. The Children's Health Insurance Program, or the CHIP program, supplements existing federal Medicaid dollars to provide health coverage for low-income Minnesotans. Today, Minnesota uses its CHIP funding to cover 3 population groups. We cover infants under age 2 with household incomes between 275 and 283% of federal poverty. Non-citizen pregnant women with incomes up to 278% of the federal poverty level, and children on Medicaid with incomes between 133% and 275% of the federal poverty level. And that last group is by far the largest group that we cover through the CHIP program. Each state receives a portion of the federal CHIP appropriation through a formula that's established in federal law. Minnesota spends its CHIP allotment by claiming the federal CHIP match on spending for covered enrollees. As many of you know, Medicaid generally covers provides Minnesota with a 50% match on medical assistance spending, so the feds pick up half the cost and the state picks up the other half. For Minnesota, the CHIP base matching rate is 65%. However, the Affordable Care Act temporarily increased the CHIP matching rate by 23 percentage points from 2016 through 2019, such that Minnesota draws down federal funds against its CHIP allotment at a rate of 88% until September 30th of 2019. Congress allowed the federal CHIP funding to expire September 30th of 2017. Since then, Minnesota and other states have been using CHIP funds remaining from previous years, as well as temporary federal funds to keep the program operating. The November 2017 forecast projected that Minnesota would lose approximately $178 million in federal funding in fiscal year 2018 and 2019 due to the loss of CHIP. And that assumption, or that projection, was based on an assumed CHIP allocation of $95 million in both fiscal years 18 and 19 that we would lose as a result of the expired CHIP funding. On January 22nd, 2018, Congress passed a 6-year extension of the CHIP program as part of a broader funding bill, or continuing resolution that funded the federal government. Minnesota's CHIP allotment for federal fiscal year 2018 is $122 million. Under the continuing resolution, the enhanced federal matching rate for the CHIP program goes to 76.5% in federal fiscal year 2020, and goes back down to the base matching rate of 65% in fiscal year 21. And the impact of the restoration of the CHIP program will be reflected in the February forecast.
Well, Mr. Greenman, to that point, so if we lost a projected $178 million in the November forecast, you're saying through fiscal year 18, we're going to get $122 million back. Do you know what we're getting or supposed to be getting in fiscal year 19? I mean, are we getting the same 178 that we thought we lost, or are we getting more or less?
Mr. Chair, we don't know exactly how much our allocation is going to be in federal fiscal year 19 at this point. The formula is quite complicated. The funding amounts differ from year to year for the CHIP program, so we're not exactly sure how much we're going to be getting.
Do we, do we think it's likely that we'll, in total, get the full 178 million back, or more or less? I mean, do we have some sort of range?
Mr. Chair, I think it's really hard to predict at this point what we'll get back. I think the fact that we're getting $122 million now, which is more than the $95 million we've been getting in the past, I think is an indication we will be getting more back. But again, that's something really that we need to wait for the forecast to.
Okay, all right, thank you. Please continue.
Then the next item I was going to talk about was the basic health plan. The basic health plan in Minnesota is Minnesota Care, and that program provides health coverage to a monthly enrollment of about 95,000 Minnesotans who earn too much to qualify for medical assistance, but who earn less than 200% of the federal poverty guidelines. Before the Affordable Care Act, Minnesota Care was a Medicaid waiver program for which the federal government provided about 50% of the cost of the program. Under the basic health plan, Minnesota Care is financed with 95% of the premium tax credits and subsidies that enrollees would have received if they had gotten coverage through the health insurance exchange, with the rest of the, with Healthcare Access Fund picking up any additional costs that would be remaining. Today, Minnesota Care is almost entirely funded through federal dollars and through enrollee premiums. A couple of recent things that have happened with the basic health plan are noteworthy. In March of 2017, the legislature passed a bill to create a reinsurance program to address the increasing costs of health insurance in the individual market. In May, the state submitted what we call a 1332 waiver to the Centers for Medicare and Medicaid Services to complete the first step of creating the reinsurance program. CMS approved the waiver, but they did not hold Minnesota Care harmless. Since Minnesota Care funding is based on premium subsidies, the level of federal funding for Minnesota Care declines as premiums go down due to the reinsurance program, and so the state's had a reduction in its basic health plan federal revenues as a result of the reinsurance program and the 1332 waiver. Based on the November forecast, DHS estimates that the reduction in federal funding to Minnesota Care under the 1332 waiver would be about $277 million, and that covers the period fiscal years 2018 to 2020. The other changes has to do with what we call cost-sharing reduction payments, which also go to the basic health plan. Approximately 25% of the Minnesota Care funding comes from these what they call cost-sharing reduction payments, or CSRs. And on October 12, 2017, the White House announced that they were ending CSR payments effective January 1 of 2018. Based on the November forecast, we've determined that discontinuing CSR payments will result in a federal funding loss of about $529 million for federal fiscal year 2018 to 2021. So the combined cuts to Minnesota Care from the loss of the 1332 waiver and the loss of the CSR payments means a total federal funding loss of about $806 million to the basic health plan from fiscal year 2018 to 2021. However, based on the November forecast, federal funding through the basic health plan is sufficient to cover Minnesota Care costs through at least fiscal year 2021.
Questions for Mr. Greenman? Representative Dean.
Thank you, Mr. Chair. Mr. Greenman, you kind of went over some of the federal money that goes into Minnesota Care or our basic health plan, and if I'm not mistaken, it's Minnesota and New York are the two states that have such a plan. And I believe about 8% from the last numbers that I looked at were the premium support within the plan. How much of the federal funds, are there any federal funds that will remain moving forward, or are the two revenue streams the entirety of all of the federal money that goes into that?
Mr. Chair, Representative Dean, we still get premium tax credits for the basic health plan. We just get a lesser amount of premium tax credits than we would have gotten. If you look at this document, might be helpful. What it shows you is on the second to the top row, it says federal BHP revenue, and along those lines, if you look at fiscal year 2018, it shows $594 million. That's what we would have gotten for the basic health plan through premium tax credits and the CSR payments, if not for the changes that I just described. If you go down one row below that, you see the loss of funding due to the reinsurance, or to the 1332 waiver, and then you see the projected loss of CSR payments underneath that of $64.3 million. And then if you go one row below that, you see what is actually still coming into the basic health plan. And that's, I think, in the answer to your question, it's about, in fiscal year 18, we get about $462 million in federal funds going into the basic health plan.
And Mr. Chair,
Representative Dean.
Mr. Chair, Mr. Greenman, if I'm not mistaken, the BHP reimbursement has been above cost of plan, creating accumulating balances within the fund. Do you know what the anticipated total cost of the fund would be absent the balances that we're looking at for moving ahead next year?
Mr. Freeman.
Mr. Chair, Representative Dean, I don't know if I could do math that quickly, but you can see you could compare theoretically this top row that says federal BHP revenue to another row here that basically says total BHP expenditures. That would tell you sort of what the difference would be if we'd gotten the full amount of federal funding. But what I can tell you right now is that the BHP account will have a positive balance of about $98 million at the end of fiscal year 21.
Representative Dean.
And last, we have had accumulating balances that have grown over time because the revenue into that fund has exceeded the BHP spending. And if I'm not mistaken, the sunset for the 2% provider tax can go away, and we would be able to fund Minnesota Care through 2021 if these numbers hold out. Is that correct?
Mr. Greenman.
Based on the November forecast, we're projecting that we could fund the Minnesota Care program through 2021.
Thank you.
Other questions? Representative Liebling.
Thank you, Mr. Chair. Mr. Greenman, I wonder if you could just talk a little bit more about this thing called CSR, which we use so much jargon in Health and Human Services, but that I think it stands for cost share reduction. Am I right about that? And so what I'm just like to understand a little bit better is where this comes, how this is operated in Minnesota with our basic health plan. So I had understood that these were payments the federal government made to insurance companies to make up for some reductions that insurance companies gave consumers. Certain low-income consumers would get a break on their out-of-pocket costs, hence the cost share, and that the federal government then under Obamacare was paying back the insurance companies for those reductions that consumers got. So could you just explain a little bit how that operates then to impact our budget? Just so that because I think I heard you say that there's a reduction from the fact that the Trump administration's not going to fund those. I think we got that. And I had initially thought that was going to impact insurance companies, which might then raise their rates to people who are buying health insurance, but how that comes in and affects our budget.
Mr. Greenman.
Mr. Chair, Representative Liebling, I think your understanding matches my understanding of the cost-sharing reduction payments. The federal government had been paying insurance companies to keep premiums low for low income, and I think it's 250% of poverty is the maximum for lower income citizens, and because of our basic health plan and the fact that we were providing health coverage for lower income Minnesotans, we qualified. What we got to fund the basic health plan was the equivalent of 95% of the premium tax credits and the subsidies that people would have gotten if they'd bought in coverage through the exchange. And so if those people had bought coverage through the exchange, those CSR payments would have gone to probably the insurance companies to cover their costs. But since they were on the basic health plan, those payments came to the state and funded helped to fund the basic health plan. And so when the White House decided to stop the CSR payments, those payments had to stop coming into the state, and so they've completely ended.
So,
Representative Liebling.
thank you, Mr. Chair. Thank you, Mr. Greenman. And I know this stuff is so complicated. I'm glad that you understand all of it, because I don't know how many of us understand all of it, but I think I'm getting it here. But so the that 95% that we get, what's funding our basic health plan is that we're getting 95% of what the feds would have otherwise given us if those people had been buying an insurance plan on the exchange and gotten a premium subsidy, basically. We're getting 95% of that for our basic health plan. That's kind of what I always understood. And then if I'm understanding you, that cost sharing reduction extra payment is just part of that 95%? Was that kind of in, maybe you don't know this, but in the legislation, federal legislation that kind of laid this out, did it include those cost sharing reduction payments in that, or was it supposed to be in addition to that 95%?
Mr. Greenman.
Mr. Chair, Representative Liebling, I'm not 100% sure enough to answer the question. I'd like to go back and try to get some more information and then get that to you. I think that's a good question. I'm not sure.
Okay, thank you. Thank you, Mr. Chair.
Representative Carlson.
Yeah, Mr. Chairman, I'm trying to get a handle on the excess revenue that's coming in. And I don't know if the question I'm about to ask even applies, but back maybe when you worked for the Minnesota House, I don't know, 2010, 2011, there were certain service reductions. I remember a lot of discussion about dental care and then other reductions in services to help balance the budget. And I don't think most of those have ever been reinstated. Is there a tie here when we say there's excess revenue where some of those services that were removed could be reinstated? Or is that totally different revenue streams?
Mr. Greenman.
Mr. Chair, I'm not sure that the two are connected. Certainly the cost of what we get for the basic health plan in terms of federal revenue is equal to what people would have gotten if they'd purchased what they call a qualified health plan under the Affordable Care Act, which covers a pretty broad range of services. I'm not sure if the coverage is quite as comprehensive as medical assistance, but it's a fairly broad range of services. And so that's the money that comes in. I think if you compare that to the cost of what we spend to provide coverage for people, you certainly one could argue that the cost is cheaper because certain benefits may have been reduced in the past that would have driven up costs further. But I don't know. It'd be really hard to track that and try to figure that out if that's really the case.
Okay, and
Representative Carlson.
Mr. Chairman, I qualified my question by, there's such a complicated area. And years ago, I was on Health and Human Services and knew more about some of the detail than I recall now. But I do remember when we had some difficult choices to make in terms of what was going to be covered for low-income people. And there was debate about the kinds of services that you would receive. And it impacted both dental and general health services outside of dental, physician services and so on. And I was just curious, being that there was excess revenue coming in, if that could have been used for a purpose like reinstating some of that. I know Hennepin County has expressed an interest as recently as last night, quite frankly, of trying to reinstate some of those services that were cut several years ago. And I think they referenced 2010, 2011, somewhere in that period of time. And I remember that was a difficult budget period. But thank you.
Mr. Greenman, I guess I've got one last, first a comment and a question. First of all, I guess I'm pleased to see that the bottom line still shows a positive surplus when you get done with all this, despite the changes at the federal level. I guess it is interesting to see just how much federal BHP revenue was supposed to go up and how even after the changes, it's essentially now flat or just slightly increasing, although the expenditures, of course, are continuing to go up. But going to the 1332 reinsurance waiver, so we lost about $270 million in federal aid in doing that. And I'm trying to remember, how much did that cost us? Was it $532 million? Somehow that number sticks in my mind. You know, I guess what I'm trying to figure out, what was the net in the end on that? Do you know?
Mr. Chair, I'm not familiar with the $532 million number. My understanding is that we did receive approval to use and this is something the Commerce Department would probably speak better to than me, but I believe that when we got the 1332 waiver approved, we were able to allow people who bought coverage through the individual market to still get tax credits as well as get the lower premiums, but we weren't allowed to go into the BHP and do the same thing. We weren't allowed to continue to get subsidies as if premiums hadn't gone down, and that's what we were essentially asking the CMS to do, was to pretend our premiums hadn't gone down and to continue to give us tax credits as though they still were high, and that's where the $277 million comes in. I'm not sure about the 532.
Okay, all right. Any other questions for Mr. Greenman? Representative Liebling?
Well, thank you, Mr. Chair, and I think you bring up a really great question, which is, what did that reinsurance program cost us? And I think you're right about that number, but I don't think it's over just one biennium. I kind of sticks in my mind that number might apply a little over more than just 2 years.
Okay.
But if staff knows, I think it would be really important for us to have that right here, because I'm looking at this sheet in front of us. It says that the analysis assumes that the waiver, and I call it an insurance subsidy, the subsidy that we gave insurance companies to reduce premiums, reduces the individual market premiums by 17.5%. That's what's assumed here. I guess I'd like to know from Mr. Greenman whether we know what that actual number is, because what we had before was a program that was reducing premiums by 25%, and that was costing us a lot less. So I think it's really important we've got consumers who are right now, again, struggling with very high premiums. I've been getting emails from people saying, what the heck, my premiums are really going up again. And when I had the nice 25% reduction before, and now I don't. So I think it's really important to look, because we put in a bunch of money. I don't know if it was 532 or some, but it was hundreds of millions of dollars. And we lost $277 million from the feds for doing this. And what have we got for our consumers? I think it's looking like we're getting for our consumers a lot less than we had before, for a lot less money. So I don't know, Mr. Greenman, do you know what the reduction is? I mean, is this assumption that you have on the sheet, is that kind of the best we got right now, 17.5%?
Mr. Chair, Representative Liebling, I believe that's the best assumption we could make based on the November forecast, what we knew in the November forecast. I'm not sure that may change with the February forecast.
Yeah, so, Mr. Chair, and just, to kind of close the loop on it, I mean, I would say that this is not a very successful policy if we pay hundreds of millions of dollars more and actually get less for our consumers. I would say that that's perhaps not a very smart thing that we did, and maybe we should rethink it in the next session.
I will say, Representative Liebling, I think that you're measuring where it was as opposed to where it might have been without this program. And without this program, you might have people that were seeing much higher increases than they have seen. But I brought up the question because we did spend a lot of money doing it. I do think it had a positive effect in buying down premiums from where it would otherwise have been. But we did obviously lose a bunch of federal money out of it, too. And so I think it is important to try to get to the bottom of it and just understand what the effects are. And I guess if we don't have the answer here today, I think we'll just have to have staff dig it out. And probably when we get the February forecast here in a couple of weeks, we'll have more information on it, too. But it is an important question as we try to deal with cost of health insurance. Seeing no other questions for Mr. Greenman. Mr. Greenman, thank you for coming down and giving us your testimony.
Thank you.
Okay, members, first I'll have House Research get ready to come up. But in regard to this next topic of talking about some sort of, potential continuing resolution, I first want to say that this is not something that is an agenda item for me. It was really triggered by, as I mentioned, the Supreme Court decision that seemed to imply that Ramsey County might no longer have the authority they've taken in the past to fund essential services if there was some sort of government shutdown. And given that sort of change in the landscape, I thought this was a topic that was worth talking about, particularly since we're not facing anything like it right now, so no one can think that this is an immediate issue that we have to deal with. But, this is a vexing issue. I was here in 2005 when a small part of the state government shut down. I wasn't here in 2011, but some of you were, and obviously a bigger part shut down. It is a vexing issue for our constituents and state citizens when that happens. But it's also a difficult issue in my experience to come up with a policy to deal with, because I think, you need to have the pressure on, so to speak, to come up with a agreement and get the job done. And I think if we would go forward and do something, we've got to make sure that we don't put into place some sort of law that makes it harder to actually reach a deal. And by that, I mean, if you just said, well, we're going to let things just continue to, run at the same level after June 30th, we'll continue to just fund things until we get an agreement. Well, if you're in some sort of a budget crisis, you will face the decision where you do need to cut spending, and yet there might be a group of people who say, well, I like the continuing resolution that just continues to run things at 100% of funding. And so then you have a greater difficulty in coming up with a solution to the problem. On the other hand, if you have a law that says we will actually cut funding some, recognizing that if this happens, there will probably be a budget crisis. There might be some members that like the idea of government funding being cut and might not be so interested in coming up with an agreement that would eventually get to the point where we could reach an agreement. So I think if we do something, we've got to be careful that we don't put into place some sort of statute that makes it harder for us to reach a resolution that we would want to have. But I don't, like I say, have any agenda on this particular issue. I'm not looking to act on it this year. However, given the changing legal landscape, I thought it was something that we should look at, because perhaps with the landscape changed, perhaps it is something we should do if we can actually figure out a reasonable way to do it. So with that, Mr. Sullivan, welcome to the front table. I won't say welcome to the committee, but can you give us sort of your rundown on House Research to give us a little bit of an introduction on this topic?
Mr. Chair and members, thank you. I'm Colby Sullivan with the Nonpartisan House Research Department, and I'm the legislative analyst for this committee, just for the record. Thank you, Mr. Chair. And here's an outline of the topics I'll cover briefly here, talking about continuing appropriations. I'll start by just describing quickly the current budget-making process for context, and then define the term automatic continuing appropriations and other terminology that's useful for this discussion. And then I'll look at the three main policy elements in any automatic continuing appropriations law. That's the scope, duration, and amount of funding that's automatically provided. I'll take a look at the 2 states in the union that have these laws in place now, and then finish by addressing any implications from, excuse me, as the chair mentioned, the Minnesota Supreme Court's decision in the case concerning Governor Dayton's item veto of funding for the House and Senate. So as members of this committee know, every 2 years, Minnesota lawmakers pass a new state budget through a series of budget laws. These are 11 to 12 omnibus bills that this committee is very familiar with. And collectively, the budget laws establish the size and scope of state government for the next 2 years, and they authorize the legislature, the courts, state agencies, and the constitutional officers to access money in the state treasury for their operations. And although some programs in the budget are funded by ongoing statutory appropriations, most entities receive their operating money through direct appropriations that must be reenacted every 2 years. And I'll define those terms a bit more in a future slide. And then finally, without new funding, then these entities may shut down or cease to operate due to a lack of funding. So I define automatic continuing appropriations as a permanent law that would fund the continued operation of state government if a budget is not enacted through the normal budget-making process before a new biennium begins. So if Minnesota were to adopt such a law, lawmakers could still pass a new law through the standard budget-making process, but this law would reside in statute, and it would be invoked if funding was not in place when the new biennium began on July 1st of an odd-numbered year. And I contrast that with a lights-on law, which I define as a temporary law that appropriates funding one-off and only for the current budget impasse. And that's a very common tool at the federal level. Congress calls these continuing resolutions. They provide funding for a number of weeks. It's less common to do lights-on bills in Minnesota, but during the 2005 shutdown, partial government shutdown, there was a law passed that provided funding for 2 weeks to keep the unfunded agencies operating until the final budget bills were passed. So other terminology that's relevant to this discussion, direct appropriations are standard time-limited appropriations that must periodically be reauthorized in a new law. So these are the standard appropriations that members of this committee are very familiar with. So much is appropriated per fiscal year. The authority to spend under that appropriation typically ends at the end of the fiscal year, or in some cases at the end of the biennium. This is in contrast to statutory appropriations, which are established in statute or permanent law. And the intent behind statutory appropriations is to provide ongoing authority to spend money for specific purposes in a defined or some sufficient or open amount. And unlike direct appropriations, with statutory appropriations, the authority to spend persists in law until repealed or amended by a future legislature and is intended to continue even if a new biennial budget is not enacted. The base appropriation is also a term members are very familiar with. It's basically a budget planning tool that's used to estimate the cost of operating state government under current law in future years. And it's also used then as a measure of a program's ongoing costs or tails in future years. An entitlement program is a fairly unique program. It's one where the law essentially requires the state to provide funding or other benefits to any person or unit of government that satisfies the eligibility criteria in law. So an example of an entitlement program under this definition in Minnesota would be property tax refunds for homeowners and renters. In the case of homeowners, if a homeowner applies for a refund and meets the criteria, that is, their property taxes are high relative to their income, they're entitled to a refund according to statutory criteria. So with entitlement programs, or what we call in Minnesota typically forecasted programs, there's an open, essentially, not always, but there's often an open amount of money appropriated for that purpose. So the base in the case of an entitlement program is not the prior spending level, but it's a forecasted, projected amount of how much it would cost to fund that program in the future. So in this case, I believe the Department of Revenue, they forecast the amount of money they think will be required to provide property tax refunds based on data they have about state income and property taxes and estimates and assumptions they make about demand in the future. So any of the automatic continuing appropriations laws that are in other states, they have 3 key elements for policymakers to determine: scope, amount, and duration of funding. Scope determines which agencies or programs in state government would receive funding under the law. This could be all agencies and programs and entities that received funding under the prior budget, or the legislators could determine that a subset of programs would receive funding automatically. The amount concerns the amount or level of funding that's provided under the law. And the United States Government Accountability Office has looked at this issue, and they identified at least 3 different possibilities for the amount variable. The first is current rate, which they define essentially the same as Minnesota's base budget process, so prior levels in general, but entitlement program spending could fluctuate based on demand or need in the future period. Current operating level, USGO defines as basically base plus some sort of inflation factor in periods where rising labor costs or inflation or some other factor makes it more expensive to operate existing programs in the new period. And then the final option is restrictive, and that's some lesser amount of funding than was provided previously, and that's called for in the base. So restrictive is usually expressed as a percentage of base funding, 90%, 80%, 70%, something like that. And the duration is how long would the law authorize money for in the case of an ongoing budget impasse. It could be as short as 1 month or a matter of weeks. It could be a fiscal year, indefinitely, et cetera. Based on my research and the research of the National Conference of State Legislatures, there are 2 states that have these laws in place right now. While some states have laws that continue some level of funding, maybe just debt service, but it's limited to very few activities. Only Wisconsin and Rhode Island have broad authority and appropriations under their law that would continue essentially all functions in the event of a budget impasse. In Wisconsin, the language provides that existing appropriations, so appropriations for the previous budget biennium, would remain in effect at the same level until amended or eliminated. But entitlement spending is uncapped, meaning it can fluctuate up or down depending on need. It is not in Wisconsin pegged to prior levels. But the same thing is true in Rhode Island, which has a very similar statute. Their existing appropriation amounts remain available to each department and division as provided under prior law. And I was in touch with staff from both states and learned a bit more about their experiences. In Wisconsin, the law is a little over 50 years old, and it's relatively common, apparently, in Wisconsin for legislators and the governor to go past the June 30th end of the biennium and negotiating and adopting the budget. And the law then in Wisconsin kicks in to provide funding and prevent a shutdown during that period of time where the negotiations continue. The staffer I spoke with said sometimes it's political differences that cause the delay. Other times the governor just takes several days or weeks even, as apparently is allowed under Wisconsin law, to review the budget, knowing that there won't be a shutdown in the meantime. According to staff, the latest date that the budget was enacted under this law in Wisconsin was November 4th of 1971. And more recently, in 2007, the budget was not enacted until October 27th. So in some years, apparently they do finish on time, but it's clearly possible in Wisconsin for the budget-making process to continue into the summer and the fall. Rhode Island's law is even earlier. It dates back to 1935. According to staff, it's rarely invoked or has rarely been invoked, but just last year, the law provided funding for approximately 1 month until the budget was finally enacted in early August that year. So finally, I was asked, as the chair mentioned, to identify any relevant implications from the Supreme Court's decision in the item veto case. I think it is relevant because the court cited the history that in 2005 and in 2011, petitioned Ramsey County District Court did provide funding for certain they deemed critical services. And that effectively limited the scope of the shutdown that year by funding certain activities that would otherwise had to have shut down. And the Supreme Court in this 2017 decision, though, addressed the topic of court-ordered funding and found, in their opinion, that the plain language of the Minnesota Constitution does not authorize the judiciary to provide funding for the legislature absent an appropriation. And they cited then Article 11, Section 1 of the Constitution, which says that no money may be paid out of the state treasury except in pursuance of an appropriation by law. Talking with other staff in my office, we think it's important to note that in this case, the Supreme Court was addressing just the issue at hand. That was funding for the legislature in the current circumstances. So it's not entirely clear that if petitioned in the future, the judiciary would not provide money for maybe critical functions of the executive branch or the judiciary itself, or even for the legislature in different circumstances. But we think it's safe to say that it does sort of cast doubt on the possibility for court-ordered funding in the future should the legislature and governor not pass a budget by the time a new biennium begins. That's all I have for my slides, members. I'm happy to answer any questions if I can.
Questions for Mr. Sullivan? Representative Driscollowski.
Thank you, Mr. Chair. Thank you, Mr. Sullivan. So just on the Supreme Court decision, if I remember the last two shutdowns, and part of the context is both of those decisions happened during those government shutdowns in Ramsey County District Court. And so this last decision was the first time the question ever elevated to the Supreme Court. Does that not kind of give us some direction and actually say to the court then, actually maybe from the Supreme Court to the rest of the court, this is our message on this? I mean, that's what I've been hearing from folks.
Mr. Sullivan?
Mr. Chair and Representative Drazkowski, I think you're right. I think that is a powerful message giving which level of the court system it came from. I guess just as a general matter, been cautioned in the past not to generalize decisions of the courts and say, well, if they ruled that in this case, it will clearly apply if a different set of facts come before the court. So I think that's why a little, I guess, cautious in saying it's clear that court-ordered funding is ruled out for the future. But I think you're right. I think it was a powerful statement coming from the Supreme Court.
Thank you, Mr. Chair. Thank you, Mr. Sullivan.
But Mr. Sullivan, the court in their language really, well, this was about legislative funding. So it seems like the language they're talking about here just related to court-ordered funding for the legislature as opposed to other, corrections, the executive branch, other places. Is that correct?
Mr. Chair, that's correct. So they were speaking just to the issue of the legislature and its funding. It presented with a situation where there was no budget in place for judiciary and public safety, let's say, and the prisons. There wouldn't be staff to staff the prisons without additional funding. The court may very well see the issue differently.
Other questions for Mr. Sullivan? Representative Carlson.
Yeah, I am curious, Mr. Sullivan, you referenced Wisconsin and Rhode Island. My recollection, Wisconsin is in session and out of session without a special session being called. Am I correct on that?
Mr. Sullivan.
Mr. Chair and Representative Carlson, I'm not positive, but my understanding is that they do operate much more as a year-round legislature.
That's what my point. Yeah, they take kind of breaks and then they reconvene, and I don't know quite how that's structured constitutionally, but and I don't know anything about Rhode Island relative to that, but it seems to me that some of what happens here with some of these states might also be impacted on the structure of their legislature. Some legislatures, I know the legislature can call itself into special session. There are a number of states that do that under various criteria. There are some states that are literally full-time year-round. My point is that the structure of the legislature and their constitutional authorities as to when and if they're able to be in session could impact on some of these things as well. That probably should be part of the discussion. In Minnesota, as we all know, only the governor can call a special session, and that often plays a role in the bargaining then when you're trying to put a budget in place. In a state where the legislature could call the special session, that would change that dynamic. So point being, there's just a number of side issues that do impact on how all of this would work.
Representative Hillstrom.
Thank you, Mr. Chair, and I'm not sure who the best person to answer this question is, but given that the governor just line item vetoed the legislative funding, if this were to go into effect, would the effect of this be that the legislature would get 90% of its funding, notwithstanding the fact that the governor line item vetoed the budget?
Mr. Sullivan.
Mr. Chair and Representative Hillstrom, with the language that's in members' packets, are you referring to the CS 104? I think that is how the language is drafted, yes, that if the governor were to item veto funding for a specific entity, under this proposal, that entity would continue to receive funding at 90% of prior levels.
Representative Hillstrom.
Thank you, Mr. Chair. Does that not cause a constitutional problem, just as we just had a constitutional challenge? Because you would then be saying that the governor's line item veto authority is now null and void if they line item veto an entire agency or an entire branch.
Mr. Sullivan.
I think that is a good question. I think, one example that I thought of is if, let's say, the legislature proposed to double funding for the judiciary, and the governor said, I think that's irresponsible, I think that's too much, and the governor vetoed that funding, then the courts would, under this language, as I understand it, would still be able to operate, but at some lower level than previous funding. So I guess in one respect, the governor would still have the ability to check spending by the legislature, but the governor's ability to completely eliminate activities or entities may be curtailed if those activities would still be funded under this language in the event of an item veto.
Other questions for Mr. Sullivan? Oh, Representative Liebling.
Well, thank you, Mr. Chair. And Mr. Sullivan, just kind of following along that line, it seems like under this language, if the legislature didn't appropriate money, say the legislature decided that some agency we just wanted to eliminate it and just going to do it by not funding it. It seems like under this language, we couldn't even do that because it would continue to be funded at 90%. Am I right? I mean, maybe this is just, I know this is just a first attempt, but it kind of shows how complicated this can be, right?
Mr. Sullivan.
Yeah, Mr. Chair, and Representative Liebling, that's correct. I think, the language as drafted now, which as you say is just initial version of the language, I think if it were enacted as is and the legislature intended to eliminate funding for an organization, the legislature would probably repeal the statutes and then maybe, just to be perfectly clear, not withstand this statute. So it would to be perfectly clear in future legislation, it might be necessary to remember to not withstand this so that there weren't unintended consequences.
Yeah.
Well, what I imagine, though, to that point, though, I mean, this only becomes operative if we, say, don't pass a budget for that particular area. So if this was some program within the Department of Public Safety, and we as a legislature decided that we should get rid of it completely, and then we pass the public safety bill getting rid of it, and the governor signs it. A bill is signed, we've gotten rid of whatever program that was. I don't think then we'd see it funded at 90%, right, Mr. Sullivan? Because we would have actually passed that budget. It would only be if there wasn't any budget for that area passed that would become operative. Is that correct?
Mr. Chair, I think that is correct as the language is drafted now. It says, I believe, if I remember, it's operating money for the entities at large, so an executive agency, the legislature, the judiciary, or a constitutional officer, not each program, whether each program in the prior budget is funded or not. So I agree with that interpretation.
Okay. But I do think, Representative Liebling, you're right that, and this is the reason I wanted to have a bill in front of us. And I should mention that I did talk to Representative Carlson and ask if there were any people from your side of the aisle that had bills on this subject, because I was certainly willing to have another bill come up to look at another viewpoint if there was one. Representative Carlson wasn't aware of one, and so we just had this one, and I just thought it was useful to have something before us to kind of search out these questions. But anyway, it is useful to look at it. Representative Hillstrom.
Thank you, Mr. Chair. So I was actually trying to get a little bit more detail of how this particular proposal might operate, but if you think that that's better for another time, I can ask those questions later.
Well, again, Representative Hillstrom, this isn't something that we're looking at acting on today. I really put it on the agenda more as a informational item to look at one way that one member thought we could do something like this, and I thought it would be helpful to the committee to be able to learn more about the subject by having it before us. And I guess we'll have Representative Jessup come forward later and present the bill, too. So if there are no other questions for Mr. Sullivan, thank you. Mr. Marks, if you'd come forward. Oh, you can do it from here if you wish. Yep. Okay, go ahead, Bill.
I think it's fairly brief, but Mr. Chair, members, you should have a handout that says statutory and forecast appropriation amounts general fund. And this is just to give some perspective on a couple of the types of appropriations that Mr. Sullivan referenced and relative to our current general fund budget. The statutory appropriations, as Mr. Sullivan mentioned, are those where there is an appropriation in statute as opposed to session law. That appropriation basically continues on and on in statute unless it would be repealed or changed. So it's in the statute. Some examples, as Mr. Sullivan mentioned some of these, but debt service for on general obligation bonds, certain of the tax aids like county program aid, city aid, property tax refunds, general education aid in the education area are all statutory appropriations. And you can see on the line here, we've filled in amounts for fiscal 18 and 19 just to give a perspective relative to the budget. For the 18-19 biennium, there's $19.5 million of the general fund appropriations could be put in the statutory category. And I say could be because certain ones like general education aid, the bill actually makes a direct appropriation for those, but that, and so it's a direct appropriation, but that direct appropriation is backed up by language in statute that said whatever is needed to fund pupil units times formula allowance is appropriated. The statutory appropriation is typically not used because the direct one covers the cost, but general education aid is in that statutory category here. My footnote, there may be a few others that we haven't found yet, but I'm confident that they're relatively minor. Then the next line is forecasted appropriations, and those are the ones Mr. Sullivan described as where an entitlement is created in law, like many of the medical assistance and a number of other human service appropriations. General education aid is also in this category. The law says dollars, number of pupil units times dollars per pupil unit. So it's forecasted in the sense that number of pupil units can vary from time to time, forecast to forecast, and so on, so it changes. There are debt services also in the forecasted category as well as the statutory appropriations category. And then there are other things like property tax refunds also in that category. The forecasted appropriations total about $35 million for the current biennium. Then the next line, however, backs out the double counting. It backs out general education aid, debt service, and only counts them once because they're showing up in both of the top two lines. So there's $17.6 million in both categories. So the fourth line is the key one. There are total of appropriations in both categories, but no double counting. So $37 million in both categories. Total general fund appropriations for the biennium as of the November forecast are almost $46 million. The appropriations in those categories would be 80.8% of the total. So it's just to put in perspective that most of our general fund appropriations in Minnesota are in one of those two categories. There'd be another 20% or 19% roughly that would be direct appropriations that are not forecasted and are not statutory.
And I'll make the editorial comment that I think that's one of the more interesting numbers we'll see today, that 80.8% of the appropriations we have are either statutory or forecasted appropriations. Representative Hillstrom.
Thank you, Mr. Chair, and I'm not sure, again, who the best person to ask this question of is, what happens if we're in a deficit? And if the amount ordered, the 90%, actually puts us in deficit spending, which is prohibited?
Mr. Sullivan, did you want to take that?
Mr. Chair and Representative Hillstrom, in that case, potentially there would be overspending even at 90%, or 10% reduction to the 20% Mr. Marks has identified as being subject to that limitation. In that case, it would really probably put additional pressure on policymakers to agree to a new balanced budget because the budget couldn't run on autopilot without running out of money.
Representative Hillstrom.
Thank you, Mr. Chair, but that doesn't then put us in violation of another portion of the law and the Constitution that we can't deficit spend here, because this would be automatic. I've been here while we had tremendous deficits, and the legislature didn't want to take the initiative to make some of the cuts, the hard cuts, and they didn't want to raise taxes. And so it became a challenge to balance the budget. And if you could just simply have 90% of funding ongoing and not have to address the issue, does it not cause a constitutional problem?
Mr. Marks.
Mr. Chair and Representative Hillstrom, I suppose one safety on that is that at the time of the November forecast, if this problem went that long, at the time of the November forecast, there would be a clear deficit projected, and the unallotment laws could go into effect, where the budget reserve would be used, and then the governor would be told by law to make reductions. And but I don't know that there's anything that would happen automatically before. Well, and actually, the unallotment law is not really clear how you determine that deficit. We know that a forecast can determine it. Could it be determined earlier than November? I suspect it probably could.
Well, and Representative Hillstrom, I imagine the big stick here remains that, you know, if we start running deficits, we exhaust all of our reserves, we don't balance the budget. I mean, at some point under the Constitution, the state auditor is required to send a special property tax bill to every property tax owner in the state to make up the deficit. And none of us want that to happen. And so that's the sort of final stick that I think, you know, would make us come to an agreement. But you're right, we could, you know, probably if things were really bad, you know, under a 90% bill or whatever the percentage bill was, and this is one of the concerns I have, there might be less of an impetus to come to an agreement. But nevertheless, if we're running a deficit, eventually there would be consequences that we'd have to face. Representative Liebling.
So, Mr. Chair, in the past, when the courts have had to decide what gets funded in a shutdown situation, do we have a list of the criteria that they have used? I mean, let me just say, it strikes me that the better way to do this would be for the legislature to decide what's critical and what isn't. And in order to do that, I would think that what we'd want to do, instead of saying, I like this program, no, I like that one, is to have some criteria to decide what's essential. And so I'm just wondering if we know, I mean, it must be out there in some of those decisions, but maybe staff could give us some kind of a list or a little bit of a report on what the courts have used to decide what is critical enough that they've decided to fund it, even though obviously now we are in a situation where we're not so sure that that's legal or constitutional. But just what have they done? Because they've had to make some pretty hard decisions, too.
Mr. Sullivan, can you talk a little bit about the criteria the Ramsey County Court used in the past?
Yeah, Mr. Chair and members, I have the Ramsey County District Court order from 2011 here before me, and the general criteria that the court used, as I guess proposed by the governor at the time, there were 5 different categories. So this isn't specific, but it's basic categories of programs and services. Number 1, basic custodial care for residents of state correctional facilities, regional treatment centers, nursing homes, veterans homes, and residential academies, and other similar state-operated services. Number 2, maintenance of public safety and immediate public health concerns. Number 3, provision of benefit payments and medical services to individuals. Number 4, preservation of the essential elements of the financial system of the government. And number 5, necessary administration and supportive services, including but not limited to computer system maintenance, internet security, and issuance of payments.
Mr. Sullivan, what about education? I don't know if I saw that on the list, and I guess I don't think we got to the point that school was starting back in 2011, of course, but did the court say anything about education?
Mr. Chair, yes, the court in 2011 did authorize the payment of education aids to school districts. I don't know which of these 5 areas of core critical funding they cited in that case, but my understanding is that the first set of payments were issued under court-ordered funding.
All right. Representative Liebling, does that answer your question?
Well, it does, Mr. Chair, thank you. It would be great to just, if we could just get that, get something with that on it, and if there are any more fine distinctions within those categories, I mean, just whatever information you can give us on that, because that seems to me that would be kind of a place to start anyway.
Representative Carlson.
Yeah, I just was going to chime in a little bit on the school issue. We learned very quickly that it's not a level playing field out there, and without some payments, some of the school districts that didn't have adequate reserves would have been forced into statutory operating debt, which would have opened up a whole nother issue. So that's probably where the court was coming at it from. There were some school districts that could have operated for a period of time with their reserves, but others just didn't have it.
Other questions for either Mr. Sullivan or Mr. Marks? I guess I'll ask one last one. I guess since everyone's asking you about Representative Jessup's bill, I suppose I could wait, but I'll ask too. I guess, in looking at this 80.8% number, which is interesting to me, I believe that Representative Jessup's bill excludes statutory appropriations and forecasted appropriations from his 90% criteria. Is that true, Mr. Sullivan?
Mr. Chair, yes, that is true under the language.
So then I guess, from a sort of big picture perspective, if we were implementing the 90% number in Representative Jessup's bill, we'd be looking at 90% of roughly 20%. So you'd see a total reduction in state spending of about 2% then if that was implemented. Is that fair to say?
Mr. Chair, I think that's fair to say if the 80% doesn't grow at all, but there's potential, I think, depending on how long the law was in place before the actual budget was enacted to supersede the continuing money, that if that 80% were to grow, let's say by 5%, that would lead to additional spending above and beyond prior levels, even taking the 10% reduction to the 20% of funding, if that makes any
So
sense.
maybe 2% at most. All right, okay. Well, thank you. Commissioner Franz, thank you for coming down, and thank you for being willing to step forward and give the administration's perspective on this issue. And welcome back to the committee, Commissioner. I missed the December meeting, so I haven't had a chance to see you here for quite a while.
Well, good afternoon, Mr. Chair and members of the committee. It's good to be back to my favorite committee. And
You say that to every.
no, actually, I don't. And I actually, this is a great committee, and I really do appreciate your offer to come over and talk about. This is really an important issue. The discussion has already been great to listen to these concerns and questions about what to do given this situation. I just have a few comments I'd like to make, then joining the
please.
conversation, but thank you for the invitation. I do say you should probably always take comments from a named defendant in a case with a little grain of salt as we go forward here. But let me just begin by saying that, we all know how hard this biennial budget process is. Most of us all have lived through it many times, not quite as many as Representative Carlson, but it's time consuming, it's complex, and there are a lot of disputes. One of the things, though, that I think that I keep coming away from, talking to many of you and the governor, is that Minnesotans really expect us to get done on time. They expect us to enact a biennial budget every 2 years on time. And I think some of the discussion that Mr. Sullivan mentioned about the Supreme Court, they have really, I think, underscored the need to reach a decision. One of the things you do have to be careful that Mr. Sullivan mentioned was these cases are fact specific, and therefore a particular case, and it's difficult to take them beyond that. But I do think the Supreme Court here has provided some clarification about what they are willing to do or not willing to do. But the idea of reaching a biennial budget, they were quite clear about that. In the November 16th decision, the Supreme Court said, and I quote, the Constitution textually obligates the governor and the legislature to set the budget of our state. going on, quoting, "Principles of judicial restraint dictate that the court defer to the constitutional remedies that are available to the other branches." So I think in our discussion today, we need to keep in mind that the underlying constitutional duty to reach a biennial budget is with the legislature and the governor, and that's clear beyond any doubt. So regardless of how we try to plan for the situation where we don't reach an agreement, it's clear that the responsibility for that determination is with the legislature and the governor. But the Supreme Court outlined some reluctance to enter into this dispute, as you all know from that decision. The court stated in that November decision, "Our state constitution," and I quote here, "does not require that the judicial branch referee political disputes between our co-equal branches of government over appropriations and statewide policy decisions, when those branches have both an obligation and an opportunity to resolve the disputes between themselves." So I think it's pretty clear that the Supreme Court believes that we should and we're obligated to resolve these differences. In the September decision, the justices went even further, and they said that, quote, "They are unaware of any authority that allows the judicial branch to authorize spending simply because parties ask the court to do so. In fact, cases suggest that the judicial branch does not have the inherent power to appropriate money." So we should all recall that in the past, based on the governor's constitutional responsibility to ensure the safety and protection of Minnesotans, the state has petitioned in the past the judicial branch to authorize sufficient funds to keep the core functions of government operating, even though a biennial budget had not been enacted by the legislature and the governor. So as we all know, in prior years, the judicial solution has been the fallback position in 2001, 2005, and of course in 2011. But in 2017, the Supreme Court, I think, put us on notice. And I believe the court statements create a more urgent imperative to adopt a biennial budget on time, every time. And so I firmly believe that we should not count on a fallback plan when that political process is difficult. We should not allow ourselves to fall back to some other plan. But, you know, we must learn lessons from the budget stalemates we've had in the past. The state, you know, right now, unfortunately, is somewhat of an unwilling participant in the federal government and the Congress's inability to come to an agreement with the president on an ongoing budget. You've seen continuing resolution after a shutdown, another continuing resolution, and clearly they have trouble reaching an annual budget, let alone a biennial budget. Frankly, I think they should go to a biennial budget. I think it would make more sense for them too, but I'm sure they're not going to listen to my suggestions. But I think part of the difficulty in the ongoing, this continuing resolution process is for just in terms of running an agency or running an enterprise, when we have these ongoing disputes and we kick the can down the road for a month or two or three, you have to remember that we have to send layoff notices to people every time it comes up. And we have to do it in advance of when the actual dispute resolves itself. So we have to send out layoff notices, we have to put out discontinuation of service notices every time there's a shutdown that looms, because many times we have a 20-day or a 30-day notice we have to engage in before the shutdown actually occurs. So it's really extremely difficult to run government that way. And I think, once again, as I mentioned at the beginning, I think the people of Minnesota expect us to pass a biennial budget on time, every time. But I would like to talk a little bit today about what do we do if we have a failure to enact a biennial budget. And it's it is an ongoing risk, but how should we best manage that risk? Should we lay out a plan B, as what you've been discussing here today in statute? Would that actually help mitigate the risk, or would that actually accentuate the ability or inability to reach an agreement? Is the threat of a government shutdown necessary to force an agreement? Or is it our responsibility to have a contingency plan to keep only the most critical functions running, or do we keep it all running for a limited time? I think in this discussion, we also have to contemplate the consequences of failure to enact a biennial budget. How should we manage those consequences? Should we try to mitigate all of them or some of them, or should we try to eliminate all the risk altogether? I mean, clearly I have a lot more questions than I have answers today. But if we could agree on some certain functions of state government that we think are critical core services that need to be funded no matter what, maybe that is a pathway. I think we all agree that we're not going to shut down our prisons. But we also have vulnerable adults that we care for, the state hospital, the Anoka Regional Hospital. We have thousands of elderly veterans in veterans homes. So where do we draw the line in defining critical core functions? And I think the decision that Mr. Sullivan was reading from would be advantageous to hand out from 2011, because at the back of that decision, Chief Judge Guerin goes through the proposal that MMB presented and lists all the different agencies and what those critical core functions were, which is a really good starting place to decide, can we all agree on what are critical, what are core functions? We've been through that several times, and it's not a simple situation. One of the things that I wanted to go over was a little bit of how we did that. You should also know that the proposal that's in the 2011 case by Chief Judge Guerin really started in 2001, was revised in 2005, and was again revised in 2011. So it's been an ongoing analysis based on the Office of Management and Budget at the federal level about how you define what are critical services versus what are just regular essential services. One of the things that we did was we put services in 4 buckets in terms of critical 1, 2, 3, and 4. The first tier included critical services that without funding would result in an immediate threat to public safety or health. These generally involve services that are 24/7. For example, providing security, providing for medical care of inpatients and emergency outpatient care, activities essential to ensure continued public health and safety around food, drugs, and hazardous waste, continuance of transportation safety functions and the protection of transport property, protection of lands, buildings, waterways, equipment, and other property owned by the government, care of prisoners and other persons in the custody of the government, law enforcement and criminal investigations, emergency and disaster response or assistance, activities that ensure the production of power and the maintenance of the power distribution system, and a process for maintaining communication with leadership personnel, and in addition, the support for Minute and MMB to support those functions, those critical functions out in the field. So I think that list is something already, it's a pretty significant list of things that we would probably all agree we need to do. But the critical 2, the next tier, was another area that we agreed, that Judge Guerin agreed to fund, and this was a little bit different. This was those activities that could be disrupted temporarily or that were somewhat periodic in nature, but would become critical if not funded shortly. And that included activities essential to the preservation of the essential elements of the financial system of government, including borrowing and tax collection, contract performance where a suspension or termination could be regarded as a material default and leave the state liable to substantial monetary damages, activities that might have severe permanent negative financial impact to businesses or vulnerable persons, and then once again, the administrative support from Minute and MMB to support those functions in the field. Then we had two other tiers that were those that we thought could be shut down, at least temporarily. So you have to remember that about 80% of the funds that were general fund monies were the court agreed to pay out during the shutdown. And 80%, a lot of that were payments to the schools, as we mentioned, the payment to local governments, payments to hospitals. So there's a lot of this that is simply in that category where we would have to go ahead and make the payout. We laid off about 19,000 out of 33,000 employees during the shutdown from an executive branch point of view. So I think the key is deciding, from our perspective, we do believe, I think generally the administration believes that the deadline is important, that to extend that deadline in an ever ongoing process is not something that is really to the benefit of Minnesota. We've had some difficulties reaching that deadline, but we've always been able to reach it. And we would support continuing that, having a deadline, but maybe being able to come up with some agreement on what are those critical course services that we know we're all going to agree are going to continue, and let the dispute get settled with just the remaining activities that are shut down. I think these questions and these concerns that we have really deserve a lot of consideration, and I appreciate the discussion you're having today. I think the current consequences of failing to enact a budget on time are the primary incentive that we all get the work done. And I think that's important never to lose sight of that. At the same time, I certainly am willing, and I appreciate the chair's offer to be engaged or have further discussions about, is there a process that we can agree to in the advent of a shutdown that would at least fund core services or critical services? And with that, I'll open it up for questions, Mr. Chair. Thank you.
Thank you, Commissioner. Questions for Commissioner Franz? Representative Carlson.
Yeah, Commissioner, with your work with budgets, what is your feeling about across-the-board cuts? Because this at 90% and the state government finance bill had it at 95%. I don't remember what all criteria was in that, but I've always argued against across-the-board cuts because you're treating everybody the same and the needs might be different within those cuts. And so I've always encouraged division chairs and so on when I chaired the appropriations finance committee and ways and means that they not engage in across-the-board cuts, that they look at the budget a little bit more carefully. But I'd be interested in your reaction to, because the bill does have 90%. And so it'd be, as I would read that, it would be an across-the-board cut for that 20% of the state budget that's not protected somehow.
Commissioner Franz.
Mr. Chair and Representative, well, I do think it abdicates the responsibility to make that decision, obviously. And I think one of the things we learned in 2011, for those of you who recall, the number of entities and agencies that came forward to petition the court to be included in that a critical or core function. It was the master, former Chief Justice Kathleen Blatz, had hearing after hearing where people would say, well, my money is more important, you simply can't cut that. And the same principle applies to a across-the-board cut. I think you just, by doing it that way, you're really not engaging in some of those services that are more critical than others. I'm not going to say the ones that could be subject to a 10% cut, because then that commissioner would never talk to me again. But I think that we know that there are priorities, and that there are some things that we would never, couldn't, and really legally couldn't cut a dime from, in the sense of responsibility and oversight. So I think you really have to exercise some judgment in that, in my view, in that process.
And Mr. Chairman, that's my point historically. And I do know sometimes some of the funding divisions would use that approach across the board, others would not. And it's not, in my view, a good approach to budgeting across the board, even though that when we're dealing with cuts, it's often part of the discussion. Yeah, that was the main point I wanted to make.
Representative Hertaus.
Thank you, Mr. Chair. And just reflecting on the 2011 shutdown, and maybe as you're considering and thinking about how you keep a budget moving, I think what really broke the logjam in 2011 was the ability to distribute beer.
It's true.
Other questions for Commissioner Franz? Representative Fabian.
Thank you, Mr. Chair. Commissioner Franz, thanks for being here. You know, this past year was my first year as a chair, and I've listened to what you've said, and I agree with you about Minnesotans want us to get our work done on time. They want us to adopt a budget on time every time. And you talk about budget stalemates of the past, and we've had those, and we had one in this past session. It makes it very difficult for us to get our work done when commissioners are not empowered to negotiate until the last 4, maybe 5 days of the session. So I'd hope that in the future we can do a better job of that too. I'm very willing to work on that.
Commissioner.
Mr. Chair, Representative, no, I appreciate the concern, and the sooner you get us your target dates, the sooner we'll be negotiating with you. But you're right, we've got to engage earlier rather than later. We all run the risk of waiting too late in the process to get everything done on time, so I understand.
Commissioner, does the administration have any particular position on this topic yet, that they'd like to see some legislation, that they don't think we should have legislation? Can you speak to that at all?
Mr. Chair, members, I think the key is that we believe that the Supreme Court has given us some direction, and in the sense that this alternative funding mechanism going to Ramsey County Court, I think we all sort of feel like that's not necessarily available. But on the other hand, I think our view has been that the deadline is really important. It makes us all come to we eventually have to reach an agreement. And so I think our general view is a continuing resolution eliminates that deadline that really is important for us to engage in. So we are certainly willing to consider ways to manage a shutdown when it comes to critical core funding, but we're at this point willing to help with that, but not too excited about a continuing resolution sort of resolution.
Representative Wagenius.
Thank you, Mr. Chair. I think you're appropriately talking about this as continuing resolutions. And when people think about what Congress is doing right now, they hate it. So what it looks like we're proposing, and the bill coming up, is let's follow Congress's lead. So Minnesota has had a history of good government, and now we're going to follow Congress's lead? This is making, I'm just sitting here thinking about this discussion. It makes no sense to me why we would follow the lead of a group that citizens simply don't like and think are incompetent. It's just, this feels like a very strange situation to be discussing this kind of bill, to say, let's be as incompetent as Congress.
Well, Representative Wagenius, I have no interest in becoming as incompetent as Congress. But, you know, and I mean, this has happened in Congress for years and years going back, whichever political parties had control of Congress. As I mentioned before, I guess I'm bringing this issue before us today as an informational hearing because I do think the landscape has changed legally. In the past, when we've had these shutdowns, the Ramsey County Court has stepped forward and funded essential services, and you heard from the commissioner and how his doubts about whether they will do that again. And so I think the legal landscape has changed, and you know, we don't have any sort of a budget crisis now. It's not even a budget year, but given that, I think it's an appropriate time to consider the topic. And the bill that again is before us is not something that I'm taking a position on for or against. As I mentioned before, I brought it forward again just as an example because I always think it's good to have an example in front of us to sort of hope, you know, to focus our mind as we think about a topic. Representative Wagenius.
Well, thanks. Everything that the court does is fact-dependent. I used to write opinions for the court. The court can thread a needle, like, they can do all sorts of things. So to say that the court, hold the court up as a boogeyman right now, I don't feel that that's a really good idea. I think we have to be looking at what we're doing. Are we modeling ourselves after an incompetent Congress or not? I think that's the basic question.
So, Representative Wagenius, I guess you disagree with Commissioner France's statement in regard to his concern on the court. Is that, I guess not to put you on the spot, but I think that's what I'm hearing you say.
You can put me on the spot. Yes, I disagree. I think the facts of whatever is going on at the time will weigh heavily on a court. They always do. And we can wait for that court decision. We could move like that if we wanted to. So we're putting the cart before the horse. Let's just wait until you see a court decision if we go down the road of the United States Congress.
Okay. Representative Hamilton.
Thank you, Mr. Chairman. And my question is there a way to tie all the operating budgets together to where, for the different branches of government, to where if one is line item vetoed, they all are? And that way it doesn't eliminate one segment of government, if you will. And I don't know who could answer that, because everybody agrees we should get our work done on time, but in the event something like this happens again, the funding's cut for the executive branch, the legislative, and the judicial.
Well, I think you'd have a difficulty getting a governor to sign a bill that essentially said he couldn't line item veto anything anymore. That's what you're saying, right?
No, what I'm saying is that if you're going to take down one segment of government, you're going to take down all of them. So somehow bring it together.
Maybe I can, I don't know, Mr. Sullivan, if you heard Representative Hamilton's comment, could you respond to that as our counsel?
Mr. Chair and Representative Hamilton, I've definitely heard people float the idea that I think one way to do what you're talking about, whether this would stand up to a legal challenge, I don't know, but would be to make the different appropriations contingent upon enactment of one another, which was similar to the funding for the Department of Revenue this prior session. And of course, that was very controversial, but mechanically, I think it could be drafted the way you described.
Thank you, Mr. Chairman.
Representative Hillstrom.
Thank you, Mr. Chair. That also causes a problem when the legislature fails to enact a full budget. I've been here when the legislature went into partial government shutdown, and one year this body failed to fund the judiciary. And so the judiciary, the entire judicial budget was part of the shutdown, or the fact that we didn't have a budget. So the question, should it apply there as well? If the legislature fails to enact the judiciary's budget, even if they pass their own, should they fail to get funding for the legislature if they fail to fund the judiciary?
Representative Carlson.
Yeah, just on that point, when Governor Carlson was governor, there was some vetoes, and one of the bills that had been partially vetoed was a bill dealing with education, and I had to do a deposition that I hadn't crafted the bill in a way, at least within that bill, to avoid vetoes. And fortunately, I was able to show that the history of the way that particular bill was put together, it had always been done that way under both political parties. We hadn't done anything different. And so the governor on that particular question at the time didn't prevail. But that question was raised as to the constitutionality or the legality, I forget all of the arguments that went into it at the time, about locking things together like that. At any rate, I was going to say, when I hesitated before, I was about to make a comment, and then I decided I wouldn't, but I will now anyway. Can you imagine this body defining in law what is an essential service? And I picked up on that when the commissioner said he wouldn't dare reference a given department because that commissioner would never speak to him again. Well, we have constituencies out there, and when you begin to draw that line, as was referenced Justice Blatz when she was having her hearings, and all of the groups coming forward and saying they are essential, and all of a sudden the legislature is saying, well, you're not essential. That would create quite a debate here in the legislative process. If you were to do something like that, you'd have to do it in a very general way, because you couldn't begin to identify. Some things might be pretty clear, you know, corrections. I think that would be pretty clear that you keep the prisons operating. But as you move down that line, you're going to eventually have to say somebody's not essential, and then the politics will come into play. Be a long afternoon on the House floor.
Other questions for Commissioner France? Representative Liebling.
Thank you, Mr. Chair. And I was just going to, respond to Representative Hamilton a little bit. And I think it's great to, I like this because we're all kind of thinking creatively about how this might work. But one more thing I sort of wanted to throw in is we do have something called the single subject rule. And we've mostly honored it in the breach, as they say, by not honoring it. But I think that certain sectors of the public are really starting to be very concerned about this, and I think for some really good reasons. So I would have argued that what the legislature did with the funding for the Department of Revenue really violated the single subject rule, which is a constitutional rule. So as we think about how to do this, all the ins and outs, we've got a number of sort of guardrails, so to speak, around what we could do, and I think that that's one that we should try to keep in mind. So, I think it's a great creative thought, But the idea that we could say, if you're going to line item veto one thing, everything goes, I would argue, or I think we'd be at risk of violating the single subject rule.
Well, I just have to say, Representative Liebling, as someone who's spent a bunch of my own money to lose a court case saying you can't build a building in the tax bill, I think that having language relating to funding the Department of Revenue in the tax bill, I don't know, that seems to me to be more along the single subject line than building a new building in the tax bill. But whatever, I would agree with you that we have gone way too far with our interpretation of what is a single subject. Representative, Commissioner France.
Well, thank you, Mr. Chair, for the promotion there. Let me give you some good news, though. I mean, the Supreme Court has a lot of confidence and faith in the executive and the judiciary. If you go to, on page 28, if you go to the November decision, I highly recommend it, and I'll quote here just a couple sentences I think are really quite dramatic, and it answers Representative Wagenius's and Representative Hamilton's kind of questions. Our decision today should not be read to foreclose the possibility of a judicial remedy in a different situation. As we said in our September order, Minnesotans have a constitutional right to 3 independent branches of government, each functioning at a level sufficient to allow the exercise of the constitutional powers committed to each branch for the security, benefit, and protection of the people in whom all political power is inherent. We conclude that, given the respect the judiciary owes to our coordinate branches and the detailed specifics provided by our Constitution to resolve political disputes, it would be unwise for us, the Supreme Court, to intervene here. We trust that going forward, each branch of government will seek to avoid a constitutional stalemate by exercising its powers to promote the constitutional cooperation that Minnesotans expect and deserve. What great words to live by. I mean, it's,
Weasel words.
yeah. Well, I wouldn't say that, but they do have faith in the branches of government and think that we are obligated in the Constitution to perform those duties, and we should exercise that power.
Well, on that note, thank you for coming down, Commissioner France. We appreciate your testimony.
Thank you, sir.
Representative Jessup. Representative Jessup, welcome to the Committee on Ways and Means. And this bill doesn't have a number. It hasn't been introduced yet. Is that correct?
Chair Knobloch, you are absolutely correct.
Okay, all right. I just wanted to make sure. Okay, well, Representative Jessup, you've heard some of the testimony and other discussion on this subject as well as your bill. Can you present your bill?
Certainly. And first of all, Chair Knobloch and members of the esteemed Ways and Means Committee, thank you for allowing me this opportunity to appear before you. I'd like to just give a couple of words in preface to the actions that I would like to pursue here. Back in 2011, I was just a Minnesota citizen. I wasn't involved with politics, didn't even think about politics. And I recall the shutdown, as many of you most likely have done as well. And as we think about that shutdown, we received, as a state, significant national attention as well. Now, most times, I'm a longtime Minnesotan, was born here. Most times when Minnesota is spoken about in the media sphere, national or even public, we usually get high accolades. We're tops here, or we're second there, we're third there. And all of a sudden, we were being cast in a very, very dark light. And it was a very, I would say, a dark moment overall for our state. It was a bad situation. And I think we can all agree to that. It was 20 days worth of our state being shut down. And I just remember at that point being a citizen, and I got to be honest, I didn't feel pride in our state. I didn't feel proud to be able to say I'm a Minnesotan. It was disappointing. And I think overall that the citizens of our state perhaps had the same feelings. As activists on both sides, Republicans and Democrats, it's always like we want to blame the other party. We always want to say, hey, we're right and they're wrong. Well, that whole shutdown was because we just could not come to agreement. And the end result was, who was the losers? The average Minnesotan was a loser. And I would also go on to say that those who worked for the state, as well as their families, were also the losers. Now, it's rare for a Republican to come up here and defend a state employee, but I am going to do that. I just think this was a bad situation. Since 2011, we can see on the national scene, we can even see in the Minnesota scene, we continue to have conflicts. We continue to have Democrat versus Republican, and you guys are the worst people on the face of this earth, and we are the shining, solution to every single problem on the other side. I would love to anticipate that at some point we're going to gain compromise, that we're going to come to the middle, and there's going to be more collaboration, more collegial relationships, but I'm not feeling that. And as I bring this before you, I think back to 2011, and at that time, one of the assessments is that the public's faith in state and public officials eroded. That's not where we want to be. As legislators, as public officials, we can do better. And I look at our state. Just recently, we had another accolade that said, you know what? Minnesota is one of those that has good governance. Across all of the states in this country, in the United States, Minnesota is known for good governance. And that's what I recall. But 2011 was clearly an example where we did not have good governance. And I look at now being a legislator, along with all of you, and I look at our responsibility to average Minnesotans. And I think our responsibility is to make sure that we look to their best interests. I know each one of us is going to have differences of opinion. Okay, what is in the best interest of our state and of our citizens? But I would contend to you that we need to do something now that the Supreme Court has acted to have a contingency so that when there is an additional conflict that occurs sometime in the future, doesn't matter if it's a Democrat governor and a Republican legislature or vice versa, or we've got a Senate and a House that are opposite parties, we most likely are going to have conflicts again in the future. And I think it's beholden upon us as legislators, to think about how do we avoid another 2011 shutdown somewhere in the future. I look at the expertise of all of you. You've been here. You've done legislation for quite some time. And I challenge not only myself, but I challenge all of you. Let's come up with some way to have some mechanism, some backstop, so that if there ever is a situation where we don't get a budget resolved and accomplished in time, that there is some way that the state moves forward. We spoke about essential services, and all of us can debate what is an essential service. Quite honestly, I do not want to be in a position to establish this is essential service, and you know what, over here, this is not an essential service. I don't think any of us should be in that type of a position, and that's why I'm looking at we continue operations at some lower level. I look at this and I say, if you think back to 2011, yes, the court went ahead and they established essential services, but we still had all of our parks closed. We had rest areas closed. All of the road construction projects were laid to rest. We also had, if you went to get your driver's license or tabs, some places could do it, some places could not. We know we've got that issue going on right now, and that's a concern. And then, quite honestly, I can remember driving south in St. Paul. It was probably about noon or 1 o'clock, and hearing on the radio, you know what, there's a crisis because the beer distributors can't get their license. So they won't after, I think it was July 1st or whatever it was, August 1st, whatever. They won't be able to distribute the beer. Well, I got to ask you, is giving the license for beer distribution, would that be a non-essential service? I think if you ask the average Minnesotan, they'd say, darn right, that's an important and essential service. So I don't think any of us really want to be in a position to give a criteria, okay, we will fund this and we won't fund that. When I look at legislation, I try and look at it from the standpoint, I want something out there that is simple for the average Minnesotan to understand, that we are trying to put forth the best legislation possible. And I think something along the lines of a continuing appropriation at a lower amount is the right way to go. Do I have all the answers here? Absolutely not. I am really looking for assistance on this matter. And I ask for your help in the sense that I think we need to put something forward for what's in the best interest of the state of Minnesota and for its citizens. Thank you.
Representative Jessup, can you briefly just talk about what your bill does?
Thank you, Chair.
I know we've gone ahead and probably already had a lot of testimony about what it does, but you are the author, so I think you should fill in any other details that we haven't discussed.
Thank you, Chair Knobloch. I'm not going to repeat all that has been spoken upon. We have put in a 90% number here for continuing appropriations. Is 90% the correct number? I will leave that up for open discussion. I am not wedded to it. But I am looking at the situation that we see in our state of Wisconsin. And in the state of Wisconsin, as you mentioned,
Charles.
right, I want to say you by your first name, but Representative Carlson, as you mentioned, the legislature in the state of Wisconsin operates more on a yearly basis, whereas we are on a part-time basis. And what has occurred is they will allow for a budget not to be signed because they know that there's a continuing appropriations provision in there that will continue to keep government going. And because it's at 100%, to some extent, there isn't quite the motivation for the legislature and the governor to get together and make sure that we do get a budget accomplished. Again, we want to, if we do anything going forward, we don't want this to be a disincentive for a governor and a future legislature to get a budget accomplished. We want that to occur. We want something, though, in place in case our ideal is not met. So I would say the 90% there is simply as an opportunity to say, you know what, we all have a vested interest and incentive to get a budget accomplished. I think one of the other points, and I think Representative Hillstrom, you mentioned it, was what if we are in a deficit situation? And that might be one other reason to take a look at a continuing appropriations measure and say, we don't want it at 100%. We want to allow a little bit of a lesser amount. We have done a good governance, and I will give all of you credit for this, along with Commissioner Franz in the executive branch. We are in a very healthy economic, financial situation relative to other states in the country. And I think that from a fiduciary standpoint, we do need to be careful, as you mentioned, Representative Hillstrom, on making sure that if we were to put some provision into law, that it does take and give some evidence that perhaps we could be in a situation where our revenue is not coming in at 100% of where we would anticipate it to be.
Representative Carlson. I thought I had you on the list.
I just helped him with the name, was all.
Oh, okay. All right, okay. Other questions for Representative Jessup? Representative Liebling.
Thank you, Mr. Chair. And Representative Jessup, I know you were listening to the conversation we had. I mean, what do you say about the, I guess the idea that when you have a 90% ongoing appropriation, that it gives more incentive to some people than to others to actually settle? Obviously, people who want to cut government might just think, hey, 90%, that's good, should even be 80, should be 70 maybe, but they're not going to be very incentivized to settle by that, some people. And others might find that to be very unsettling, especially for certain programs. If we just went over and cut 10% off our prison budget, I think that the Department of Corrections would find that very, very difficult to manage. So, what about that angle of this thing?
Representative Jessup.
Thank you, Chair Knobloch. Representative Liebling. I don't know if I have got the full answer on that, Representative Liebling, and quite honestly, if you've got an idea on that, I would be welcome to it. I looked at the 90%, and for preface, my background is I'm a small business owner. And I know that in any small business or any operation, and I would say public as well, and we can even look at ourselves as a legislature. Typically, you can look at your operations, and there may be some decisions where you may put off purchases for operating type expenses, not capital, but toward operating expenses. 10% is an ask of any commissioner or any superintendent that has a budget to try and establish, okay, where could I cut 10%? But in the short term, most likely, and I shouldn't use the word most likely, but I will say in my experience, in the short term, those types of decisions can be made. You are correct. If there was a continuing appropriation at a 90% level for an extended period of time, and let's say a year, then it would be a significant issue. Absolutely, I would agree with you. My expectation, and it could be the wrong expectation, I will grant you that. My expectation is that if we went to a continuing appropriation and the legislature and the governor did not get the budget accomplished, what's the perception that even hits us today? The public's perception is, you know what, those public officials, they don't get their work done. They still don't get their work done. And my expectation is the public would be demanding that a budget get accomplished. And I don't see us in a protracted, extended period where we would not have a budget in place. I could be wrong, I could be a little bit, the glass is half full on that. But I do anticipate that sometimes we talk about the media being kind of the fourth influence in terms of government. Quite honestly, I think it's the citizens of the state. And I think there would be enough clamor from citizens all across the state that would say, you know what, you guys need to get this done. You need to get it finished.
Representative Dean.
Thank you, Mr. Chair, and Representative Jessup, thanks for bringing this forward, and I know as a freshman, you're in a unique position to do that because you run a competitive race, you're out talking to lots of people, and in your first term, you hear from lots of different kinds of people more often than senior members with specific areas of expertise or statewide significance in terms of a certain area. So you get a lot of different feedback as a freshman. As a freshman, when Representative Hamilton and I came in, we had a brief government shutdown under Governor Plenty. And we heard a lot of that as freshmen and from the people that we had just connected with. And you have a little bit of a different view of a different branch on the tree, and I think it's a good perspective. And it's one that I think a continuing resolution made a lot of sense. Now, at that time, it depends on who's in charge. If one party's in charge, you call it government on autopilot. And if the other party's in charge, you call it a lights-on bill. And if you switch governors, you switch what you call it, and you're either for it or against it, depending on where you were last year. That's just my experience here. So that's what I've seen over time. That the people arguing for it argue against it when the governor changes. And you brought up 2011. At that point, we were debating and shutting down over a $34.34 billion budget. We are looking at a $46 billion budget currently. Just from July of 2013, that was certified at 34.34. We are now at 46. That wasn't a long time ago. So you've seen that rapid growth. And you'd say, what's a better backstop? A shutdown or a continuing resolution where you continue? And the absolute abject disregard for getting a quality product done through the process over time has eroded. So that I have actually come around to reversing my opinion on this. I think that the last minute hundreds pages amendments on the floor that nobody can see, made by a few people at the last minute, has created bad bills no one understands, and bad spending. I think, and overspending. So I think that allowing the governor perhaps more time to do that and more time is a risk. But it's one that I think will have better bills if we do, because we have abdicated our responsibility as legislators to craft the bills and vote on them appropriately. So I've kind of changed my tune on this over the
Members, we're coming up on 4 o'clock. Let me recognize Representative Carlson for a last question or comment.
Yeah, I was just going to comment that if something like this were to move forward, we've spent some time talking about 90% of the 20%. And when you think of the state budget, so much of it is passed through. I think you'd have to have a discussion of what's in that 20% that would be absorbing that 90% cut. The vast majority of our dollars goes to aid to cities, counties, school districts, and I could go on and on and on with our role as a pass-through. You know, we collect the taxes and we pass it through to basically local units of government and a few other entities. And so that might be a harder hit than what it appears on the surface for certain services. I last term was serving on state government finance. You know, that would be one that would be, most of the accounts in there would be taking a really hard hit. So you'd want to look at what you're doing. And I won't lead us down to a discussion of that right now, but once this is done, I do have a quick question of you though, Mr. Chairman, about something in the future.
Oh, okay. Well, let me,
Real quick.
oh, Representative Berdahl.
In the interest of time, I really won't ask my question, but I was wondering what the majority leader, what advice Representative Dean would have given the majority leader in 2011. But I won't get into that right now.
It's a very good question.
Well, you're not asking Representative Dean to yield. Oh, okay.
ask me after.
All right. Well, let me, I gather that Representative Carlson's question is about a different topic. So Representative Jessup, let me recognize you for any last words you have.
Thank you, Chair Knobloch. And again, thank you all, members of this committee, for allowing me to speak. And I will just say, the passion that I have before you on looking at this is I look at, we can continue to focus one-on-one with one another and what makes sense and so forth. But in the end, we serve the state of Minnesota and we serve the citizens of this state. And I would say, I hope that none of us would like to see a shutdown like we had in 2011. And I think as legislators, we need to work together to find how do we incorporate good governance to ensure it does not, again, occur in the future. Thank you for your time.
Thank you, Representative Jessup. Representative Carlson.
Yeah, Mr. Chairman, before we adjourn, I wanted to ask about supplemental appropriations, and one in particular. I don't know if you're planning on a supplemental appropriations bill or not, and that's probably going to be driven by the forecast, which comes out on the 28th. But the question I have is MNLARS. They have that problem beginning on March 1st. And the governor has indicated that he would like the legislature to act during our first week of session. And so I was just wondering what your thoughts on that are. If people haven't followed it, it's a $43 million issue. And it's a question of timing.
Representative Carlson, I guess, you know, it might be more appropriate to have Representative Torkelson, who I don't think is here, speak to that, or else, I don't know, Representative Baker, I know you've been involved in that issue. I will say that my understanding is that they don't necessarily need the $43 million in that first week. But Representative Baker, I know you've been working on this issue. What would you like to add to
Mr.
it?
Chair, and thank you. I guess having talked to the commissioners and Ms. Bailey, who's kind of representing the both Minute and Department of Safety, the $43 million is not required by March 1st. However, to keep the components of improving the MNLARS system, a much smaller number is being drilled down. We're trying to find out what that number is. We're hearing anything from $8 to $10 million to make sure that that system gets moving and we can continue with our obligations that have been signed on by that team. So right now we're trying to actually get to the bottom of some of the questions that are still pending. I think we as legislators need to do something to make sure we don't let this thing get worse than it already is. It has been a complete failure, and we need to find out how we can either save the system, rebuild it, start it over from scratch. We have a lot of questions now that just was received and given to both agencies yesterday, and we should have a lot more information for all of our colleagues here to have those tough decisions that we have to make. But it looks like a much smaller number will be needed on March 1st at this point to kind of keep the wheels moving in a direction I think that will improve the system.
Now,
Representative Carlson.
Mr. Chairman, whatever the number ultimately is, and it's good to hear you're looking at that, but when you reference the other committee, this committee is the one that's going to have to determine what those resources are. That's why I asked the question. That's one of our two major roles, I guess. Everything ends up going through us at the end, but at the beginning, we have to determine what those targets are. And that committee is going to probably have to come up with recommendations as to whether or not any of that's going to be fees, whether it's going to require a state appropriation. Either way, it involves this committee, whether it's fees or an appropriation. So that's why I was asking, and the last information I had was a little bit different than what you expressed. Conversations I had a week or so ago were that that was necessary to resolve in the first week of the session. That's why I raised the question. But if that's not the case, then I'd like to find out a little bit more about what that timing is going to have to be.
Well, it's certainly
And
an
I'm
issue.
sure you would probably want to know.
Certainly an issue, Representative Carlson, that I know we will be dealing with sooner or later, so.
Well, it sounds like, at least the information I had a week ago was that it had to be sooner. And then that raised the question, if there was a state appropriation, we don't have the forecast yet if we were to operate the first week and what our revenue source would be. There are a couple of places we could go if it were something different than fees, but I'll stop there. I was just wondering what the plan was. Thank you.
Sure. Okay, thank you. Seeing no further questions, members, thanks for coming in today. I think this is a good discussion, and the meeting is adjourned.